morning. How are you today?
Good. How are you?
My name's Rebecca. I'm a nurse practitioner student at South University, and I'm going to be performing your head-to-toe assessment today. I will let you know what I'm doing as I'm doing it, and basically telling a little backstory as to why. If you have any discomfort or any pain at any time, just let me know. We can stop the exam. Okay?
Okay.
So, any questions before we start?
No.
No? Okay. So first I'm going to just look at your skin and inspect. I don't see any lesions. Your skin color is normal for ethnicity. And we're going to start with the head. So I'm looking at your scalp. There's no lesions, no masses. Any pain?
No.
No. No masses, no lesions. Okay. I'm going to check the artery. Can you open and close your mouth? No jaw popping. I'm going to push down on your chin. Just don't let me open your mouth. And check the strength of your jaw. Perfect. And I'm going to check your sinuses. Any pain?
No.
Okay. Perfect. Would you mind taking your glasses off for me just for a few minutes? Okay. We previously tested your vision and you have 20/20 vision with your glasses on. What I'm going to have you do is cover one eye and just stay looking at me. I'm going to test your peripheral vision. So tell me what number you see.
1, 2, 1, 2.
Okay, can you cover the other eye?
1, 2, 1, 2.
Okay, perfect. The next thing I'm going to have you do is I'm going to have you just with your eyes follow my finger. Just with your eyes. Just checking to make sure that your brain and your eyes are functioning. Now I'm going to go close. Okay. Perfect. Can I have you, before I shine the light in your eyes, can I have you just do some exaggerated facial movements? I want you to bring your eyes like you're surprised, like you're mad, and your cheeks. Puff them out, and stretch up your face. Okay, perfect. Just making sure that your brain is sending the signal to your face. Okay? I'm just going to inspect the sclera. Okay? And then check your pupils. So you're going to see a bright light. Okay? Pupils are reactive and round to light and accommodation, and they are equal. I'm going to check your ears. Any pain?
No.
No? Okay. And we performed a whisper test earlier, and you passed. I said pink from over 5 feet in both directions, so you were able to hear that, so that's very good. Next will be your nose. So I'm just looking, inspecting the outside, and then I'm going to cover your eyes just so I don't hurt you. And then look inside each nostril. There's no redness, no swelling. And then I want you to cover one nostril and smell. Breathe in, and the other. Okay, perfect. And we look at your mouth. So if you can open for me. Open big, big, big. Checking the mucosa, buccal. Can you stick out your tongue and say ah?
Ah.
Perfect. The uvula rises. And stick out your tongue and move it from side to side. Okay, perfect. And swallow. Instead of sticking a blade down and making you gag, that's how I'm checking to make sure that your reflex is intact. Okay, so we finished with the head. Now we're going to work our way down to the neck. So I'm just going to palpate your lymph nodes. And can you shrug your shoulders? Okay, perfect. I'm going to check your thyroid gland. And can you swallow for me? Okay. I'm gonna check your pulse. Carotid artery. And the trachea is midline. Now I'm going to listen to your carotid artery. So if you can just breathe in and hold. Okay. And the other side, breathe in and hold. Okay, perfect. There's no bruit, which means there's no unusual whooshing or blood flow issues into the neck. Yes, you can put your glasses on, sorry. Now, I just want you to mirror me. I'm checking the strength in your neck. So if you can go forward and back with your neck. Go from your ear to your shoulder. Other side. And then your chin from side to side. Okay, perfect. And now I'm going to put some resistance. So you just push against my hand. So push forward. Perfect. Push back. Your ear down, so push to the side. Other side. And then your chin, look towards me and takes the strength there. Perfect. And then I want you to push up with your shoulder. Perfect. Good job. And then now the lungs. So I'm going to start from the back. If I can have you turn just a little bit to the side from the chair. First, I'm going to look. There's no abnormal curvature to the spine. Are you sensitive? Can I touch your back? No? Okay. So I'm just going to feel, make sure there's no pain, no lumps, no tenderness. Okay. I'm going to push my hand here and you're going to do what we call kidney punch, just to check that you're not tender here. Any pain?
No.
Okay, and can you take a deep breath? Lungs expand equally. And then I'm going to take a listen. So what I want you to do is inhale and exhale. If you can do it through your mouth, that's best. If you get tired or lightheaded or dizzy, let me know and we can stop. Okay? Inhale, exhale. Okay. Okay, do you feel dizzy?
No.
Not lightheaded? I'm going to listen here on the side, so deep breath again. And the other side. Okay, thank you. I'm going to have you sit back normally. And we're going to do the same in the front now. So just inspecting, you're breathing very easily. You don't look like you're having any trouble breathing, no distress. Any tenderness?
No.
No? Okay. So let's listen. Deep breath, inhale, exhale. Okay, then listen here to the side. Inhale, exhale. And this side. Okay. While I have you sitting, I'm going to go ahead and listen to your heart. So just breathe normal. Listening aortic. Pulmonic. Curves. Mitral. And then the apex. Sometimes with the women, it's hard to get to the apex. Can you lean forward a little bit too? Perfect. You don't have any murmurs, which mean any abnormal opening and closing of the valve. So that's good. Nice and strong, healthy heart. Okay. Now, can I have you do some more with your hands, some more range of motion, and check your hands? Okay. So just checking the skin's temperature. It's nice and warm. Good skin turgor. And check your fingers for capillary refill. That's how good is the circulation to your hands, and that's perfect. Okay. And then check the fingers for range of motion. Your wrist, any pain, side to side, open and close. Okay, perfect. Elbow. Okay. Shoulder. What I want you to do is just go up, down, out, across, and then kind of do like what you're signaling on a bike. Okay, well, a little more like this. Any pain?
No.
No? Okay. Let me check your radial pulse. Perfect. And your brachial pulse. Perfect. And I'm going to do it to the other side as well. So, good. Take the fingers, split them for me. Okay. The pulses. Okay, now we're going to do the same. Arm out, down, up, out, to the side, that's okay. Across your chest, and then the shoulders. Bring it up, and bring it down. Okay, now I'm going to check your strength. So I want you to put your arms straight out in front of you, and I'm going to push up. Do not let me. Now the opposite. Okay, perfect. So now if I can have you come up, we're going to finish doing our exam, okay? No pain or discomfort?
No.
No? Okay. So the next thing I'm going to do is, like I told you, sometimes with women it's a little hard to hear the heart when you're sitting up because of the breast tissue, so I'm going to listen to your heart again, okay? And I'm going to check the carotid artery to make sure that there is no abnormality, that your jugular vein here is not pulsating. I can check your carotid artery again. Okay, perfect. Okay. So I'm going to listen again to your heart. Aortic. Pulmonic, curves, mitral, and I'm listening for 15 seconds to check the apical pulse. Good, nice and strong, regular. Can I have you lean a little bit to your left? Perfect. I'm just checking again for the murmur, which is the abnormal whooshing sounds. Okay, perfect. You can come on back. Are you comfortable?
Yes.
Here, let me fix this for you. There we go. Alright, just gonna look at your abdomen. It's flat. It's not round, nice in color. Are you ticklish?
No.
Okay, perfect. I'm gonna start by listening and then we'll feel. So, right lower quadrant. Perfect. Right upper quadrant. Are you hungry?
Maybe.
Okay. And I'm gonna listen to the aorta. Okay, perfect. No whooshing sounds. That's good. Sometimes if you have high blood pressure, you can hear a whooshing sound. Then a percuss, which is, you know, here there's air. Good. You don't want it to hear. You don't want to hear a flat sound. You want to hear like a bubbly. Okay. And I'm gonna touch now. If you get too ticklish or it hurts, let me know. Anything? No? No? Okay. So moving on, we're going to test your hips. So what I want you to do is just, with this right leg, just bring it straight up and straight down.